Good evening, all, and welcome to tonight's president series, Hope Nigeria. Tonight, we have one of our guests, Dr. Babagana Kundi Martina. To reduce the impact of COVID-19 pandemic in Nigeria, we are excited to bring you an exclusive with a psychiatrist, Dr. Babagana Kundi Martina. He obtained his in the year and before taking a residency training program in psychiatry at hospital. He was a registrar in 2011 and 2000, then senior registrar between 2013 and 2016. He obtained his African College of Physicians, Faculty of Psychiatry, and of the National Postgraduate Medical College of Nigeria in 2013. He became a consultant and obtained his fellowship in the psychiatry from the West African College of Physicians in 2016. And thereafter, he returned to his home state of Yobe to establish the Department of Psychiatry Specialist Hospital, Damaturu. His master's degree in health planning and management was awarded in 2014 and was appointed as a consultant in State Specialist Hospital, Damaturu. Dr. Martina is a leader when it comes to solving skills. He held senior positions in many student as well as Nigerian, including the president of University of Medical Secretary of Nigerian Medical Association, Borno State Branch, Secretary of the Northeast Caucus of Nigerian Medical Association, and more recently, Young Psychiatry Association. Dr. Martina is an outstanding clinician, educator, a leader, and an incredible prolific writer. He has great management of a functional specialist hospital in Damaturu, where he served as a medical director between July 2017 to November 2019. He has mentored and supported a countless number of colleagues to find their way in actualizing their dreams of becoming a specialist in the field of specialization. Dr. Martina is the current executive secretary of the Healthcare Management Board, a position he has been holding for almost a year. He is a member of the force on COVID-19 on Deputy Governor of Yobe State. His Excellency Alhaji co-chaired the state response team on COVID-19. He has published widely in peer-reviewed journals as the shores of Nigeria. He is married and blessed with children. Dr. Kundi Martina enjoys badminton, swimming, and tennis. To introduce you, it is also our pleasure for the Science Communication of Nigeria to present his webinar tonight. Dr. Kundi Martina.
Thank you very much, Dr. Hosseini. Thank you very much, everybody. Today I will be talking to us about ways of safeguarding emotional and psychological well-being in the face of the COVID-19 pandemic that we are faced with. And I want to adopt this outline: introduction, psychosocial stressors that are peculiar or that are evident during the COVID-19 pandemic, tips on how to keep emotionally and mentally well, guidance or messages to special populations, and then we conclude. Thereafter, we'll have some time for questions and answers. Please come with me. By way of introduction, we can all remember that on 31st of December 2019, a severe acute respiratory syndrome was reported from Wuhan city of Hubei province in China, which was reported to the World Health Organization. The syndrome was caused by new coronavirus. And in January 2020, the World Health Organization declared that the outbreak to be a public health emergency of international concern, with a high risk of spreading to other countries of the world. And in March 2020, the WHO declared COVID-19 a pandemic. To date, more than 1.1 million persons have been confirmed to be having the disease, with a total of over 64,400 deaths. Although the risk of death from this disease is estimated to be about 1.38%. There has been a huge emotional and psychological burden occasioned by this pandemic, and which affects a large number of the population. Increase in rates of, for instance, increase in rates of alcohol and illicit drugs abuse, depression, anxiety, post-traumatic stress disorder, and suicidal behavior have been reported in several countries, especially in Europe. It is therefore important for us to look at ways in which we can safeguard our emotional and psychological well-being in the face of this novel pandemic. The stressors that make it very important for us to look after our emotional and psychological well-being, and which in themselves predispose us to having psychosocial issues, include fear, especially that of the unknown, reduced social interactions, especially with the social distancing and then lockdowns that are being seen, as part of containment efforts against the pandemic. Burden of caring for the sick, worsening of underlying health conditions, which may a lot of, especially in terms of comorbidities, individuals can perhaps have reduced chances of being offered adequate follow-up, or can have difficulty assessing their refills of medications. This can actually worsen on any underlying health condition, and consequently also serve as a stressor. As a result of this pandemic, several employers have laid off or downsized their workforce, leading to, of course, loss of employment and loss of income. Daily paid workers have their income reduced because they hardly can go out to work on daily basis as they used to. Some actually in areas that have complete lockdown, it may almost be impractical for some of the daily paid workers to actually go and work. This actually serves as a psychosocial stress also. Many people have lost loved ones to this pandemic. And then, of course, there's this widespread feeling of helplessness, especially in the sense that there's no any specific treatment for this disease. Another stressor is the constant stream of negative reportage that we get concerning the COVID-19 pandemic. Being a new disease that has not been encountered in and of itself previously, that novelty actually adds to the stress, because we are dealing with, or we are working in literally uncharted waters. And then, of course, there's a large-scale scaremongering among the population, which also adds to the psychological distress. How then do we keep well? It is important for us to manage our expectations. We should know that although our overall capacities may remain the same, there are situational circumstances that make it better for us to readjust our expectations about ourselves and about other people over whom we superintend. There's nothing wrong in adjusting our skills or scaling down some of our activities, if we feel we're having difficulty concentrating and rest in the light of the pandemic, for us to adjust our expectations accordingly. This will actually help reduce a lot of the emotional stress that we are going through. It is important to also manage your stress threshold by ensuring that you eat adequate and balanced diets, of course, without binging, and of course, to also have adequate sleep. and to exercise moderately and exercise well, especially exercises that we derive pleasure from. This will not only increase our likelihood of repeating that behavior, but also will ensure that we are consistent and also feel well after doing that. It is important for us to maintain our routines in terms of when we wake up, when we sleep, when we eat, when we jog, when we do all other things, and ensure that we follow that routine as much as possible. This not only helps in reducing or managing our anxiety, but also helps us in quickly adapting to the situational changes that we find ourselves in. It is also important perhaps for us to consider working in small bursts with clearly defined and outlined breaks. So maintaining that structured life routine can actually help us keep well emotionally. It is important also for us to maintain our social cycles, the social bonds, social relationships, because these are important things that we need to keep. It enhances our sense of well-being. It reduces boredom. It reduces stress. In fact, it has been shown that maintaining good social relationships actually raises the level of the happy hormone in our system and help us overcome adversities. So it is important that we do this, even if it be through virtual fora, such as co-working space, online book clubs, or even social media. When we help others or ourselves, it makes us feel good in our spirit. So we should learn also to be compassionate to ourselves and to others. We need to know and appropriately respond to our own red flags. What are these red flags? They could be our thoughts, like, why am I not thinking clearly? Like, um, uh, is this supposed to be some kind of punishment for what I did or for what some of our ancestors did or what? These are thoughts, these are cognitions. It can also be about our feelings. We start feeling perhaps helpless, or feeling sad, or feeling frustrated, or feeling angered. These are all red flags that will indicate to us that perhaps we need to take good care of ourselves emotionally and psychologically, about how we feel, our sensations, our actions. If we believe that our actions, we are starting to have actions that are likely to be problematic, for example, binging on alcohol, excessive indulgent behaviors that are likely to harm us psychologically, and all those. These are all things that actually um, can feed into each other and continue to amplify all these negative experiences. So we have to get a way of breaking that jinx by perhaps doing any activity that we feel can de-stress us, can help us to de-stress. And this can be something like even deep breathing exercise, or perhaps any relaxation therapy. For some of these things, we may need assistance. It is also important for us to actually manage our uncertainties by staying in the present. We should take each day as it comes. Perhaps we may not know what tomorrow holds, but let us try and stay in the present, work with what we have, deal with this day as it is, and then look towards tomorrow with optimism and hope. Of course, it is important for us to know that this pandemic is unlikely to just disappear in a day, but we should be optimistic that things will get better, and hopefully soon. We should remember this is not a sprint, it is a marathon. So we should do what we can, take a rest, deserved rest, and then carry on from there. What is my message to healthcare workers? Healthcare workers are likely to be under a lot of pressure, tremendous pressure. This is what can cause anybody to feel on edge, sometimes to feel frustrated, sometimes to feel even threatened. It is okay for us to feel somewhat fatigued from time to time, but we should know that we need to manage our own mental health and psychological well-being just as much as it is important for us to manage our physical health by wearing personal protective equipment and the rest. It is important for us to know that we need to keep fit, we need to keep well for us to continue to protect the lives and well-being of members of the society. It is possible that some healthcare workers, especially those caring for persons suffering from COVID-19, may themselves find themselves being stigmatized and avoided. In such situations, it may be useful for healthcare workers to turn to our colleagues, to our managers or superiors, or to some other trusted persons for support. Or indeed, we also need to be supported to remain physically and mentally well so that we can continue to do the good work that we are doing. It is important for managers, or top management staff, and leaders to protect their staff from chronic stress. It is important to protect your staff from chronic stress. Consider rotating staff from high stress to lower stress roles periodically, with times off for them to actually go and de-stress, for them to rest, for them to link up with loved ones, and generally for them to rejuvenate, because their productivity depends to a very large extent on their mental health. It is important for managers to ensure that their staff know exactly where and how to access mental health and psychosocial support services when they need them. This is something that should happen. This is something that is supposed to be in the psyche of each employee in your workplace. It is important to ensure there's good communication and provision of accurate, up-to-date information to all staff to enable them to keep safe. Here, information can be a matter of life and death. Carers of children should help them find ways of expressing their feelings in appropriate manners. Feelings such as fear, sadness, anxiety, and even curiosity. As much as possible, we should keep children close to their parents and family, even where they need to be isolated. We should provide engaging and age-appropriate activities for the children to keep themselves busy, including activities for their learning and recreation. We should help children maintain familiar routines as much as possible. And where new activities will have to be introduced, they should be ones that generally will entice the children, or that will arouse their curiosity and their eagerness to learn. We should identify and respond to children's concerns and fears using age-appropriate information materials and approaches. Where needed, external support from appropriately trained and qualified personnel can be enlisted. For people in isolation, It is important, very important, for you to stay connected with your loved ones and maintain your social bonds. You should exercise regularly, including, if need be, new exercises that may have to be adapted to the situations in which you find yourself isolated. An individual that loves bowling, for instance, may not find that comfort of having to go to getting to go to the football pitch, but may be able to create something within the environment that within his isolation environment to exercise regularly. As much as also individuals in isolation centers or in even self-isolation or individuals that are being quarantined should try and maintain daily routines, which as we have said earlier, will help individuals adapt to new changes and will be less stressful and less associated with boredom. If needed, we need to create new activities for people in isolation that will give them pleasure and take out boredom. We should only seek information from qualified health personnel and avoid listening to rumors that can make you uncomfortable. At this point, I would like to say that for everybody, we should avoid being exposed to constant streams of negative reportage, of gloomy picture, of the ever increasing statistics of confirmed cases, of deaths and the rest. Perhaps we should rely only on reliable sources of information. For example, the World Health Organization website, the Nigeria Center for Disease Control, or any relevant or any institution that is so saddled with responsibility to provide information. And then that in itself also should be at periodic, at some intervals, perhaps once or twice in a day. Maybe once in the morning you go to that information source and know what it is that is happening about COVID-19, and maybe perhaps later in the day. Avoid being exposed too much to this negative news that can actually arouse a lot of anxiety in you. What is also helpful will be for people to actually share and amplify success stories about individuals that have actually been cured and discharged. Success stories about the resilience of populations, about what support has been gotten, about the hope for effective treatments, positive stories that lift the spirit. In conclusion, I would like to reiterate that with the right attitude, practice, and support, we all can play our roles in safeguarding not only our own emotional and psychological well-being, but also the emotional and psychological well-being of those within our cycles of influence through this COVID-19 pandemic. Thank you, and God bless.
Thank you so much, sir, for the wonderful and precise presentation. We have some questions here, but before we start with the question answer sessions, I would like to tell our viewers that this program is brought to you by Science Communication Hub Nigeria. You can contact us via our handles through Facebook, through Instagram, through Twitter, and we keep updating you with information with regards to COVID-19 pandemic. To start with the questions, so I have a question from Jafar Askira. He's asking what's your view on exercise? Do you mean that exercise can actually prevent person from contracting the disease?
Um, Perhaps not. What we are saying is that exercise is important, not only for emotional and psychological well-being, but even for physical well-being, in terms of even boosting our immunity, in terms of for us to actually be able to ward off some ailments, even in terms of the um, physical health. But of course, emotional and psychological well-being, exercise actually makes you feel good in your spirit, makes you feel more lively, and perhaps reduces the chances that these negative emotions around, these negative or psychosocial stresses that are going around will have, will take a toll on you.
Yes. Thank you so much, sir. We have the next question from Mahmoud Karmena. He's asking that during this period, some people find it difficult to maintain the same sleeping pattern. That is, what time to wake up. Will this add more stress to them? And what are your tips to avoid this?
Yes, of course. Sleep disturbance is one of the stressors that actually, even outside COVID-19 pandemic, individuals actually deal with. But this pandemic actually can add to that, and it is important for us to actually maintain regular routine, maintain our routine where possible, where we are not having this. If an individual, for instance, is having perhaps because of some psychological distress associated with this, is having poor sleep or is unable to sleep early and may have to compensate, by sleeping for longer than he usually does. It is important for us to adopt what we call sleep hygiene. That may help. I will share with us the main themes or the main things that are done in sleep hygiene. One is to actually ensure that we maintain the same um, pattern, time of going to bed and waking up as much as possible. We avoid extreme exercises or very strenuous exercises from the evening. We avoid caffeinated drinks or cola in our own local context um, during evening hours. We avoid heavy meals. We sleep in. We try to sleep in regular, warm, and comfortable environment. We minimize noise, put out the light, and we ensure that we keep our rooms, of course, only for sleeping and perhaps where appropriate, sexual activity. But we don't go to the room to read or go to the room to even exercise, so that our minds will be conditioned to actually tilt towards sleeping when we get into the room. These are a few of what we do that is referred to as sleep hygiene, and maintaining this can actually help us, can promote good sleep. I hope that helps. Hello?
Hello?
Yes. Okay, I
Okay.
hope that has
All
answered
right. Thank you so
the
much
question.
we have, yes, we have the next question from Khadija Bobo. She said, what measures do you advise the government to take for risk management for its health workers, as many health workers might be stressed, depressed, or may even contract the disease, that is the
Yes,
virus?
yes, I think I actually made a specific call to government or to
Yes, yes.
employers and to managers, but I will reiterate it here. First is for us to ensure that we protect our staff or the health workers in this context from chronic stress. So, of course, the issue of human resource for health is key, where you have quite a limited number of human resource. Um, Even outside COVID-19 pandemic, they actually will be overstressed, overstretched from work. So it's important for us to have adequate number of human resource, and then for us to give them shifts so that they will have time off to go and relax, to go and socialize with their loved ones, to rest, to exercise, and all those other things that we have said. It is important for government to know that the productivity of these individuals matter. People have to be in good physical and mental health to be able to actually safeguard the health of the population. So it's important that um, these individuals are taken care of. Another thing is for people to, for government to ensure that, or for managers of the health facilities to ensure that workers are rotated from higher stress roles to lower stress roles periodically. So it will not be like one person will be at the accident emergency or the intensive care unit for the whole month. If that has been the case previously, during emergency situations like we are in now, it is important for us to actually rotate people across so that there will be redistribution of this stress, and then people will not be exposed to chronic stress that can actually take a toll on their emotional and psychological well-being. It is also important for all employers to ensure that they provide adequate and up-to-date information to their staff on how to protect themselves. That information will also include the provision of appropriate protective equipment. Even if the protective equipment have been provided, but they're in the store, and the health workers are not aware of the presence of these things, it will, that thought that they are not adequately protected to perform their duties will actually continue to serve as stressor to them psychologically. So it is important for them to have all the information that they need to have, including the availability of the protective equipment, and where possible, maybe life insurance policies, and of course, also for government to provide them with the information as to where and how they can access mental health and psychosocial support services when they need them. Because actually, as I have said, health workers have been exposed to a lot of stress even prior to COVID-19 pandemic, and this present pandemic only adds to the stress that health workers have been going through. And that was why when I started talking about specific populations, I started with health workers, because they are like the gatekeepers. They are the ones that are in the front line battling this pandemic, and it is important that actually the system protects them to be able to productively discharge their duties.
Okay, thank you so much for the answer. We have the next question from Hussein Mosi. He said, excellent presentation. What is the government doing to address emotional and psychological well-being in the face of COVID-19, considering the fact that we have inadequate specialists?
Yes, okay. Is this question specifically about Yobe State?
Well, actually, I did, but
or the government of Nigeria, or well,
I guess maybe I think what we are going to do is we'll start from the Yobe State government, then maybe move upwards.
Okay. Or we start international and then come down.
Okay, maybe.
Yeah. Okay. It is important to understand that internationally, the World Health Organization brought out guidelines on dealing with psychological, psychosocial, emotional, and psychological distress in the context of COVID-19. This was released by the World Health Organization on 18th of March and provided guidelines to national and sub-national governments on how to ensure that they protect the emotional and psychological well-being of their various constituents. Nationally, the Association of Psychiatrists in Nigeria is leading a response to see how we can scale up psychosocial support services. And this task force or Vanguard, which is entirely voluntary, consists of psychiatrists. The advisory board actually has 2 psychiatrists, 2 clinical psychologists, one psychiatric nurse and one occupational therapist, one each occupational therapist, psychiatric nurse, and psychiatric social worker, to draft the national response plan, to respond to the mental and psychological issues that are arising as a result of this COVID-19 pandemic. Then at the level of the Yobe State government, government is doing all it can to see that it strengthens the capacity of the system to provide psychosocial and to provide psychosocial support services. Already 4 local governments have been mapped, high volume LGS, Watuskum, Damaturu, Gaidam, and Geshua, to actually provide psychosocial support services. Discussions are ongoing to finalize the formalities of engaging more clinicians that will actually be able to do that. Just last week, a renowned psychiatrist has been engaged also to help out with this response plan, in addition to those of us that are on ground already. And then radio and TV programs are ongoing to educate individuals on how to keep fit mentally and emotionally. So just last week, we had one on YBC, Yobe Broadcasting Corporation. And then, as I have said, it is better to do a preventive approach, a population-based approach, than a case-based approach in the hospitals. So we are adopting the population-based approach to see that we actually get the most value with the least resources.
Thank you so much. Thank you so much. We have that you mentioned that some people might develop anger or fear due to the nature of the pandemic. How can individuals maintain their mental health and avoid developing such feelings?
Yes, it is important for us to look at the antecedents of this. These are actually feelings, feeling of anger or feeling of fear. Feelings. This can be feelings or thoughts, but there are antecedents usually that lead to this. So the antecedents may be perhaps exposure to too much negative reportage as led to the COVID-19 pandemic. It can be perhaps the, as I have said, the helplessness of this case. And then for each individual, the individual knows what led to that feeling of anger or fear. It is important for us to look at the source and take it out. So, as I have said, minimize your exposure to those negative reportage. If there are any positive news that can lift up your spirit, for example, the rate of recovery. For instance, in Nigeria alone, 27 persons have been discharged. That is more than 5 times the number of fatalities in COVID-19 pandemic. It is telling us something. Over 200 people have been confirmed positive. Only 5 with 5 deaths regrettable, but far greater number have recovered, and that is the news. That is the story globally. These are the kind of hope-inspiring messages that we should be pushing out to inspire hope for people to know that COVID-19, by the grace of God, is not going to be the end of the world. The world will overcome, and such positive, thoughts, such optimism can help us conquer those fear and anger. However, should these feelings continue to be sources of distress, then an individual can actually seek for help within his or her local health system. Yes.
Okay. We have a question from Yunus. Said, what is the effect of stress on our immune system, and how do we know our level of immunity?
Yes. Okay. Uh, Stress has a very negative, especially chronic stress. Let me be specific. Now, we are all in fact, we need some level of stress for us to actually function optimally. So we're not talking about the normal day-to-day stress. We are talking about chronic stress that can actually lead to distress. Chronic stress has been shown to actually lower immunity in much the same way that chronic illnesses lower immunity. Chronic illnesses like diabetes and hypertension, for instance, lower immunity. And studies have been carried out to even look at the level of stress hormone called cortisol within the system. And it has been shown that even chronic anxiety or people with chronic anxiety or chronic stress actually have raised levels of cortisol in their body, which is the stress hormone, similar to what is seen in individuals that have chronic physical illnesses. And these have been shown to correlate with reduced immune function in the body, making us more vulnerable to develop to actually be weighed down by common illnesses like malaria, like even common flu, and many other infections and infestations. So taking stress off our body actually helps us a lot in boosting our immunity and increasing our capacity to fight off some common ailments. And you asked, how do we know our level of immunity? Well, scientifically speaking, we indirectly measure the level of immunity by the level of the blood component that actually fights for us, the white blood cells. So this is a bit technical, but there are actually tests that will give us an indirect measure of how functional or dysfunctional our immune systems are when we do the complete blood count. And then we see specific components of the blood that are supposed to be within certain normal limits, which, of course, if they are raised, will show us that there's likely hood that there's an infectious process going on. And perhaps if they are quite low, it also shows us that our immune system is, of course, deranged to the extent that we may be vulnerable to infective agents.
All right, thank you so much. We have Muhammad Rislan. He said, does psychological distress vary across different geographic groups, and does it affect an underlying mental case that one does not know about?
Of course, psychological distress vary depending on the resilience of the individual. That is why most of the things that we've been discussing is about how we can actually build resilience at both the individual and community level. This is what we've basically been doing. So individuals that have resilience, which is their capacity to adapt and respond to stressful or distressing situations, actually determine how psychological distress or stressors actually affect us. For individuals, for example, that are in good physical health, for example, they are less likely to be as distraught by psychological stressors as those individuals that were up initial suffering from some physical or especially chronic illnesses. Someone that is already down, perhaps having a lot of physical conditions, battling with old age, battling with some terminal conditions, and then this psychological distress comes, it will actually, of course, take a greater toll on him than an individual that was previously well adjusted and in good health condition. And even age matters. Age and our previous experiences. If an individual, this is why I said one of the stressors about this COVID-19 is the fact that this is a new pandemic. The novelty of this pandemic makes it a greater stressor. So, because if the individual has had previous experiences, we could have learned from our previous experiences of a similar pandemic, and perhaps easily adjusted to some of the realities. So, not having previous experience in itself can be stressful. So there are demographic situations, like I have said, physical condition of the individual, financial state, social connections. An individual that is on his own, even previously isolated, even before the coming of this pandemic, is likely to fare worse than an individual that has good social connections and of course has a lot of social support. An individual that was even previously unemployed, for example, or underemployed, will not be able to adapt or be resilient and be protected from the negative consequence of this psychological distress as someone who doesn't. So actually, there are a lot of differences in how some of these psychological stressors actually, in how much toll they take on individuals. And then if we also look at the age demographics, individuals at the extremes of age, that is very young individuals and very old individuals, are more likely to suffer the negative consequences of these stressors than individuals that are within their prime.
All right, thank you so much. We have another question from Dr. Ogaraku. He said, thanks for the lecture. Sir, what is your take on pregnant health professionals in the front line in terms of emotional and psychological well-being?
This also, we can take this as in the context of even comorbidity also. Although pregnancy, is not an illness in itself, but in many ways have been so likened. So if we look at pregnancy on its own, it's a stressful condition with a lot of physiological and psychological changes that actually accompany them. And then putting these individuals in the front line at this time may not be the most appropriate of actions. So if we're actually looking at vulnerable people that we should protect, it should also include pregnant health workers who should actually be given lighter or lower stress roles for them to play at work. If we are not even going to ask them to stay at home, because they are more likely to be at the to fare worse off should there be any psychological stressors, much like they are likely to also be worse off should there be some physical elements that will come, because already there are a lot of physiological and psychological changes associated with pregnancy itself. That is even if the pregnancy is not complicated pregnancy. So I think we should put in place mechanisms to ensure that our pregnant colleagues are well taken care of and are removed from harm's way.
Thank you so much. Jamil is asking, how can one manage the stress of living with children in the context of lockdown, where they can go to school and play?
Yes, I think I've talked about how carers of children should actually ensure their emotional and psychological well-being, but I'll still reiterate some points. One is to ensure that actually children have the opportunity of playing, socializing, and being children within the home environment or within whichever environment that they find themselves during this pandemic. Some children may need to be isolated themselves. Some may not be actual isolation, but may just be because of the lockdown. There may be some effects. In any of these situations or any other situation, we should try and as much as possible to see that we provide them with opportunities for them to actually play and to learn, to have things that they enjoy, and then to have things that keep them busy. In addition, they should be given the opportunity to actually express their concerns, their fear, and have them sorted out. It is important, where appropriate, depending on the age of the child, for you to even discuss COVID-19 with your children. It has been reported in some countries to be helpful in improving the children's psychological and mental adjustment to the pandemic. So where appropriate, perhaps age appropriate information can be provided to them, including prevention measures, and then how they can keep safe. Should they express excessive fear or excessive worries, we should identify those worries and fears and attend to them soon as we can. Where we don't have the capacity to do that, we can enlist the support of individuals who can. As I have said, it is important for us to provide these young ones the opportunity for them to play and to interact among themselves at home, even as we face this lockdown.
Okay, thank you so much, sir. We have virtually exhausted. I don't know if you have anything to add on to what you have said already before we
I think, well, I would like to thank you most sincerely for this opportunity for us to interact, and it is my hope that the Almighty will make discourse beneficial to humanity, and we look forward to much more of such engagements going forward. And individuals that actually, maybe there's an opportunity for those that may even watch this later, or that may have questions later, or maybe you can arrange an opportunity, a way of us getting the questions and responding to them much as we can. Thank you very much for the opportunity.
Thank you so much, Dr. Babagana Martina. And we look forward, inshallah, to have another session with you. Just like you said, we'll try as much as we can to see that we have some questions from the listeners and we find a way of channeling it to them. And we'll find another day to come and execute the questions. Listeners, thank you so much for being with us. We really appreciate your effort, your concern, your commitment towards this webinar. And we look forward to having more of such webinars, especially that now we are almost indoors and we have limited our movement. So it's important for us to share knowledge, ideas, to see how we can move our community together. And thank you so much for all of you. And I would like to tell you that you can follow us via our social media handles, our Facebook, our WhatsApp, Instagram, as well as Twitter. Thank you so much, and God bless you.
Thank you.